To your health tonight, many couples have an idea of how large they would like their family to grow, but a lot of women ask, how long should I wait in between pregnancies? Well, the answer can vary depending on the circumstances, but usually it's best to wait at least 1 year.
What a lot of the data shows, to wait ideally a year, between pregnancies. We do have a lot of evidence that if you wait less than 6 months between pregnancies, there's a higher risk of preterm delivery.
Doctors say that not giving the body a full year to recover from the rigors of pregnancy and delivery also puts a woman at higher risk of having a placental abruption, a baby with low birth weight, or possibly a baby born with an abnormality. Other research has shown an association with a higher risk of a baby having autism if pregnancies are spaced too close together. Also, doctors say when a woman's body feeds a baby in utero for 40 weeks and then breastfeeds her baby for up to a year later, the body is depleted of several nutrients, which is why experts believe the body needs some time between pregnancies. The World Health Organization actually recommends waiting at least 2 years in between pregnancies for women who are younger than 35. Doctors say women who've delivered a previous child via C-section need to let their scars completely heal to avoid a uterine rupture or opening of the scar. For these women, waiting at least 18 months is beneficial. The most important thing a woman can do before planning her next pregnancy is to visit her doctor and make sure she knows her personal risk factors.
Before you plan your next pregnancy, we recommend talking to your physician, and usually that's something that comes up at your postpartum visit because you want to talk about either preventing or planning for the next one.
For couples who've suffered miscarriage, doctors say recent research has shown that they do not have to wait a standard amount of time to try again, but more importantly, to wait until they are emotionally ready to try again.